I'm Barry Gibson. I'm a medical sociologist and I work at the University of Sheffield in the unit of dental public health. Well, for many years dentists have been basing their views in science on the clinical indicators, so looking at physical changes within the body. And it's only really since the 1980s, the late 1980s, that a group of people started to argue that really we should be listening to patients' perspectives on the conditions that they're suffering. And so for that reason, they developed a whole series of measures looking at the impact of different oral conditions on patients within everyday life. And the reason why we should be interested in patient-reported outcomes is that really we ought to understand oral health from the patient's perspective. After all, it is the patients that we're treating, not the kind of just the physical disease. We're looking at the person as a whole thing, a whole entity. And one of the reasons why these measures are useful is because they help us understand the impact of conditions basically on the whole everyday life of the patient. The DHEQ is the Dentine Hypersensitivity Experience Questionnaire. It is a questionnaire that is designed to measure the impact of dentine hypersensitivity on everyday life of patients. It has, I think, around 48 questions. We have had several versions, and we've been gradually reducing it to kind of a robust measure. And it's basically a questionnaire that helps patients map the range of impacts that their dentine hypersensitivity has in their everyday life. It measures the frustrations that they have, it measures the impact on emotions, and it measures the impact on in terms of the amount of adaptations they have to make in relation to dentine hypersensitivity. So the Dentine Hypersensitivity Questionnaire is really just a map of the everyday impact of the condition on the patient's everyday life. The DHEQ was developed because there are actually a whole ream of outcome measures, patient-reported outcome measures in dentistry. So you have, for example, the GO-HI, you have the OHIP, the OIDP, and all of those measures are generic measures. They're designed to measure the impact of oral conditions in everyday life. But one of the things about the DHEQ and the reason why we developed the DHEQ was because when you look at the content of those measures, they only have maybe, I think, around 7 items out of 49 that would actually show any kind of impact in relation to dentine hypersensitivity. So one of the first things we did when we were developing the Dentine Hypersensitivity Questionnaire was basically to take those measures and look at them and say, are these questionnaires actually going to record the impacts of dentine hypersensitivity? And when you look at the actual items on the questionnaires, there is no way that they would be able to do that because half the questionnaire isn't really relevant to that condition. So this led us to actually think about developing a questionnaire that was much more specific. I have to tell you, at the time, we didn't think this would be a problem. We didn't realize that this was a problem, actually. And it was only after we took the time to go through those questionnaires to look at the existing measures that we began to realize that they wouldn't be able to show any kind of sensitivity to change within the condition, simply because 7 items out of 49, for example, on the OHIP is just not enough. It's just not going to robustly measure the changing nature of the condition. So that was why we had to develop the measure. The existing measures just really weren't going to be able to provide a kind of robust measure of change over time. And one of the key reasons why we needed the DHEQ was so that we could actually show change, measure change over time. And so after having reviewed those measures, we basically went ahead and started to develop a new measure. The DHEQ, from the outset, when GlaxoSmithKline got involved, they approached us and they wanted us to develop this measure. What we did was, in the first interactions, we said, "How serious are you about this?" And one of the things they said was, "We're very serious." So what we did was we put together several proposals. We put together a proposal that was looking at a light version, sort of like an easy to go, easy way of measuring. The second approach was to do a kind of gold standard, industry-based kind of approach that if you were to do it this way, you would have covered all the bases. So the way in which we developed it was very simple. We followed the kind of guidelines issued by Guyot, Locker and Juniper, and we developed an approach that was in 5 stages. So the first stage was to interview people about the condition, and then to develop kind of questions from what they were saying. So, you ask someone, well, how does this condition affect you? And people go, well, I can't eat ice cream anymore. And so you get you collate a huge list of items. Now, we actually went beyond the industry standard, and what we did was we took a theoretical model and we sought out 7 items for each different domain on the model. Now, initially there was actually more than 7 in each of the domains, simply because we had to find out which ones work and which ones don't. So what you do is you get a list. I think we had 56. I can't remember exactly, but we had well over 50 items initially. And then what you do is you give the questionnaire to a series of focus groups. So we got a bunch of people in, got them to read it, look to see if the questions made any sense, look to see if they agreed with the response format. The response format is, in the DHEQ, is quite different to other quality of life measures. It's based on whether they agree or strongly disagree with the statement that is in front of them. So we gave it to the focus groups, eliminated some of the questions that seemed problematic, and then in the third stage we did a kind of a pilot study, which is where you kind of chuck the questionnaire at 70 people and get them to fill it in, see whether or not there are any major problems in the way in which people are responding to the questionnaire. So some items, for example, they might have everyone answering with the same response, in which case you've got an item that might not be particularly good. And then so you take a look at that and then eliminate more questions from that process. And then in the fourth step, we did a cross-sectional validation study, which is looking at the reliability and validity of the questionnaire. So does it measure what it's supposed to measure? Does it measure the same thing? And it was found to have quite good reliability and validity. Now, we published basically all of this, the findings, in the literature, so most of this can be readily downloaded and got hold of. And then the last stage, we did a longitudinal validation study, which was looking at it over time. Is it sensitive to change over time? Does it measure dentine hypersensitivity as it varies naturally in everyday life? And is it reliable and valid again longitudinally? And those were the 5 stages. So the questionnaire was developed using a kind of industry standard kind of approach within academia, what we would call the gold standard sort of approach. And we enhanced that by bringing theory into the process. So we went slightly further than most of the other academics that have been working in this kind of field. And in addition to that, we are probably the first group to publish the qualitative findings. So that's the findings from the interviews. And then we published the cross-sectional validation and the longitudinal validation. So all of this research can be easily got hold of in the literature if people want to read it. It's quite interesting. I think from our perspective, the development of the DHEQ has been a real challenge for us in the best possible sense. When GSK initially came to us, they had a range of ideas. They had some ideas about maybe doing some measurement of quality of life in other conditions. And we had initially thought that if we were to do anything, dentine hypersensitivity might not be the one that we'd want to do. And it's quite funny because it's interesting. As a condition, lots of clinicians and lots of people in dentistry downplay the importance of the condition. And so therefore it is kind of seen as a kind of just an irritation, really. It's just like something people have. And we had that perception at the start, and to be really honest with you. And it wasn't until we collected the qualitative data, we put together the proposal and we said, what kind of measures do you want? Do you want gold standard? And GSK went, yes. And then we started to collect all of this qualitative data, and we were amazed. We really did not expect to see the impacts that we saw, the extent, the range, and the kind of the degree of impact. To have someone sit for an hour and a half and tell you about their dentine hypersensitivity it was weird for us. We really honestly didn't anticipate it being quite as complex as it was either. So not only did they have a huge range and extent of impacts, it was extremely complicated. And we found that the way in which people were responding to the condition in everyday life was incredibly interesting. And then we discovered other stuff as we were going along. And what is very, very interesting is that GSK were very, very keen on the measure, and they were interested in developing the measure, and they also kind of funded this other kind of broader program of research as we went forward. GSK, the team from GSK were involved in everything from the start. They were very much part of the team. It wasn't just as a funder. We got them in and we were discussing data and we were discussing items that would go on the questionnaire. And I think in the middle of all of that, we realized just how much GSK have been listening to people in relation to their dentine hypersensitivity, because an awful lot of what we found, I think they already knew. But what we were doing was we were kind of producing it in a format and according to the kind of protocols that academic dentistry would expect. So the involvement was very much, from the outset, stimulating the interest, really challenging us, and then helping us kind of move forward. And I think they were very open to multidisciplinary approach that we adopted. So we had sociology, psychology, we had dental public health, we had a team with a range of different skills, and they were interested in listening to all of it. So I think when I say that they really were responsible for actually making us think about something we had never considered before. And for us, the big thing was that this condition actually has much more impact than we originally had envisaged ourselves. And so I think we've come on a real journey. We've learned a lot about GSK in the process. The work we've done in the DHEQ has produced loads of different surprises, actually quite a few. The first thing is that the sheer complexity of dentine hypersensitivity, for me, as a sociologist looking at this as an oral condition, to me indicated that we have kind of underestimated the complexity of the mouth in everyday life. We have underestimated that the range of different oral conditions that affect people will affect them in quite different ways, and that whilst it's important to have generic quality of life measures and generic oral health impact measures, there may be quite a few conditions that have a range of other impacts that actually indicate the complexity of the mouth and how the mouth plays an important role in our everyday lives. So for me, the first big thing was to just really challenge what I had was a very kind of simplistic idea, coming from, you know, having read the OHIP, the OID peak, OHI, which to me are the main measures in oral health related impacts. And to have come from an environment where I felt that those were really the gold standard, there really wasn't any need for anything else, to suddenly beginning to see that the mouth is much more complex than perhaps I had envisaged. So dentine hypersensitivity, and looking at it and looking at its impacts and the difference that it and the challenges it presents to people in everyday life really helped me move beyond a kind of very narrow view of the impact of the mouth in everyday life. The second thing I think that was really significant about this was that really peculiar thing happened when we were doing the interviews. So we interviewed all these people, and as I said earlier when I was talking, the patients could talk for up to an hour and a half. So they would be telling us about, you know, like some very weird things, you know, like, I have to microwave my ice cream. I have to kind of wait for 50 minutes before I can eat cheesecake. And kind of really odd behaviours that they were having to do, strange adaptations in order to avoid the sensitivity that they were experiencing. And then, almost to a person at the end of the interview, they would go, but it's not a big problem, it's just nothing, it's no big deal. And we got very curious about that. As a sociologist, to me, that tells me something very strange is going on, because you can't have someone talk for an hour and a half about impact and then just go, but it's not important. So what we did was we became very curious about where that might come from. And why is it that there is what I would call a socially conditioned response to the condition? And I'm not going to go into the complexity of it, but GSK, in a way, have stimulated us to go and look at the concept of dentine hypersensitivity. And we recently published a paper looking at the concept over the last 180 years. And what we discovered was that dentine hypersensitivity as a concept is kind of considered in a kind of very derogatory manner in some respects in dentistry. Dentists often don't hold conversations with patients about dentine hypersensitivity. So one of the things that will happen is the patient will tell you, they go to the dentist and they say, I've got sensitive teeth. And the dentist will go, use Sensodyne or use whatever product that comes into their mind. And that's the end of the conversation. And so historically, the truth is that patients have been conditioned into not bothering their dentist with this condition. And the reason for that is because dentine sensitivity is what dentists are interested in. Because dentine sensitivity is sensitivity that occurs as a result of disease. And of course, the dentist is there to prevent disease, real disease, in the form of caries, holes in teeth, and things that can lead to the rotting of teeth falling out. And dentine hypersensitivity historically developed just as a bit of a nuisance on the outside of the interests of the dentist. So we published this research, and this is one of the big things about getting involved with the DHEQ. We ended up with all sorts of other findings that just we hadn't really anticipated. Historically, the definition of dentine hypersensitivity as a short, sharp pain arising from exposed dentine was first proposed in, I think, 1983. And that definition only developed in the literature because before that time, the condition was basically a kind of strange enigma. That dentists kind of got these weird patients that would come in and complain of sensitivity, and there was no disease, and they were kind of odd and things, and so it became a kind of a condition that people talked about, but there was no clinical definition. So what happened was the definition proposes that dentine hypersensitivity is a short, sharp pain from exposed dentine that is the result of no other pathology or no other cause. So it's a definition of exclusion, as it were. And that definition has only really become established later when the Canadian Association adopted it, as it were, in a consensus kind of definition. Now, those definitions are as a result of the clinical worldview. So the clinician looking at the mouth, looks for pathology, looks for kind of exposed dentine, and then describing the structure of the teeth comes out with a kind of a definition of something from his or her perspective. But the DHEQ actually maps the experience of that hypersensitivity and produces a measure of that. And it has a number of different domains. So it tells us about, first of all, for example, the number of adaptations people have to make in relation to their hypersensitivity. You know, so for example, I can't eat ice cream, and the different problems that they're experiencing that they have to change. The next thing it tells us about is it produces an indicator of the emotional impact of dentine hypersensitivity, the frustration, the annoyance that the condition produces for people in everyday life. The measure also looks at the way in which dentine hypersensitivity impacts on someone's social life. And so therefore, really what we're talking about is a composite indicator of the impact, rather than it just being either present or not, which is what the definition says. What we have is a kind of a complex indicator that can provide a very sensitive measure of the range of different impacts that someone experiences in their everyday life as a result of dentine hypersensitivity. So what it does is it deepens our understanding. It promotes a depth of meaning to the condition from the patient's perspective that we really haven't had up until now.